blood glucose measurement for adult patients with diabetes via the capillary method and educational video.
The nurse enters the room, greets the patient, and explains she has come to measure the patient's blood glucose. The nurse verifies the patient's identity by asking for their name and social security number. Relevant factors to consider before blood glucose measurement. Assess the overall well-being of the patient. Illness, infection, injury, and recent surgery may affect glucose value. Ensure that you are taking a fasting value or a value in between meals. Ensure if patient has exercised before measurement, as physical activity influences glucose levels. Check if the patient has taken insulin or other medications which affect glucose value. Ensure if patient has consumed alcohol or caffeine which can influence glucose value.
Before measuring, check. Hand hygiene. Ensure the patient's hands are clean and dry to prevent contamination and inaccurate readings. Sampling site. Use the sides of the fingertips for sampling, avoiding areas near the nail bed, thumb, or index finger to reduce discomfort. Glucose test strips. Check the expiration date and that the test strips have been stored correctly in a closed bottle, as out of date or incorrectly stored glucose test strips can lead to inaccurate results.
The equipment needed for this procedure includes disinfectant, gloves, a sharps container, a glucose meter, glucose testing strips, a safety lancet, cellulose swabs, and a plaster. The nurse should disinfect her hands carefully and let them dry. After this, the nurse puts gloves on to maintain aseptics and avoid contamination.
In preparing the glucose meter, the nurse must confirm that the test strips are not expired by checking the expiration date on the bottle and that they are suitable for the type of glucose meter in use. When inserting the test strip, it must be held from the sides of the test strip to avoid contaminating the test window.
After insertion, the machine should automatically turn on.
The nurse holds the safety lancet in one hand and with her other hand she twists and pulls the safety cap off.
It is recommended to prick the middle or ring finger because of the presence of more capillary blood, less pain sensation, and more reliable results. Instead of the fingertip, the side of the finger should be used. After choosing the sampling site, the nurse presses down the safety lancet to prick the patient's finger. The first drop of blood is wiped away with a cellulose swab for more accurate results. After wiping the finger, the nurse takes the prepared glucose meter and testing strip close enough to the second blood drop. A sufficient amount of blood is absorbed. The machine processes the result. The glucose meter will make a sound and will count down from 5 to 1, then displays the results. After the result, the nurse puts a plaster around the patient's finger. All used safety lancets should be disposed of in the sharps container. Other wastes, such as testing strips and swabs, can be disposed of in the mixed waste bin. The nurse relays the results to the patient. In this table, you can see what different blood glucose values indicate.
Instructions on equipment maintenance, calibration and error codes. Always follow manufacturer's instructions or manual. Test strips. Use compatible test strips recommended for meter being used. Avoid expired or damaged as they may cause errors. Storage. Keep test strips in their original container away from sunlight, moisture and dirt. Always handle with clean and dry hands. Lancets. Dispose of used lancets immediately in a sharps container. Expiration date. Regularly check expiration dates on the test strips.